Hello, lovely students. Welcome back to our channel. In this lesson, we will discuss the Maturita topic, healthcare. Are you ready? Let's get started. Good health means a longer and happier life. Health, together with love, is the most precious gift that people have. How to prevent illnesses, diseases. To stay fit and keep our mind and body in good balance, we should eat healthy foods, choose foods that are good for your health and provide essential nutrients. Stay active. Take part in different sports or activities. Avoid spending too much time sitting in front of screens like the TV, computer, phone, or playing video games. Handle stress. Try to avoid situations that make you feel worried or stressed. Stay away from alcohol, cigarettes, and drugs. Get outside, spend time in the fresh air, and move around regularly. Sleep well. Make sure you sleep regularly and get enough rest, just like this cute dog, for example. Stay positive. Try to see things in a hopeful and optimistic way. Cultivate a positive outlook on life. Everyone in our country has the right to choose a doctor. Medical care is provided for our citizens from birth to death. Children's diseases. After birth, each child is vaccinated against these diseases. Tuberculosis, whooping cough, measles, polio, chickenpox, and mumps. Each school child is under medical supervision, which means they have to undergo a series of preventive medical and dental checkups during which their body is examined, their teeth are checked, and their eyesight is tested. Question time. Why should people take care of their health? What rules should we follow to stay in good shape? Which diseases can affect small children? Most often, we suffer from common infections such as a cold and a sore throat. Our nose is running or it is blocked. We sneeze and cough a lot. Tonsillitis. Our glands are swollen and we cannot swallow. Flu. We have achy joints, high temperature, headache, and physical fatigue. A chest infection. When you have a chest infection, breathing becomes difficult. Common infections are very contagious, and we try to recover from them on our own. We stay in bed. We take pills, drops, and vitamins. Keep warm. Sweat a lot. We also drink herbal tea with honey or lemon. The best thing we can do is to simply rest in bed completely. After a couple of days, we should feel better again. But if we still feel unwell, we finally decide to see our local doctor, who is called a general practitioner. Question time. Can you list any common infections and their symptoms? Give some tips on how to recover from common infections without seeing a doctor. What is another term for a local doctor? At the doctor's office. First, we have to wait in the waiting room until the nurse calls us into the examination room. The nurse has to locate our medical record and asks to see our insurance card. Her other duties include taking the temperature, checking the blood pressure, taking blood, and testing the urine. After all, we are ready to enter the doctor's office. The doctor usually asks us how we feel, what problems we are having, or what's bothering us. If we have a headache, a sore throat, a cold, or a cough, we need to mention it. Then the doctor examines us. He listens to our lungs and heart, asks us to take a deep breath or hold our breath according to his instructions, makes a diagnosis, writes a prescription for us, and finally, schedules the next checkup. Then we go to the drugstore where we can get antibiotics, gargle, cough syrup, vitamins, ointments, nose drops, and painkillers. We need to take medicine according to the doctor's advice, and for a short time, we may be unable to attend school or work. Every household should have a first aid kit that should contain a clinical thermometer, bandages and sterile gauze pads, Band-Aids, scissors, and some pain relievers. Question time. When do you go to see the doctor? What questions do doctors ask their patients? Describe what happens in a doctor's surgery. What is the nurse's job? What medicine can we take at the pharmacy? What items does a first aid kit contain? Critical illnesses. Sometimes the situation may be critical and requires special treatment in a hospital. Here are some serious illnesses that require special treatment. Heart attack, pneumonia, jaundice, stroke, concussion, blood poisoning, insomnia, salmonellosis, appendicitis, breaking an arm or a leg. In the hospital, injured people are examined and X-rayed. Very serious cases are immediately operated on in the operating room. Doctors who work in hospitals are usually referred to as specialists, for example, surgeons, psychiatrists, internists, ophthalmologists, gynecologists, dermatologists, illnesses of civilization. Many people suffer from pollen allergies, food allergies, diabetes, Obesity. Cancer. Cancer is one of the biggest threats nowadays. Every year, more and more people of all ages are diagnosed with tumors of all types. Daffodil Day is a public collection organized to raise money to provide support for people with cancer and their families. Question time. Which diseases do you think are the most serious? Why? Can you name any medical specialists in English? Have you ever had to go to the hospital? If so, what for? How long did you stay there? Which illnesses related to modern lifestyles can people suffer from? What is Daffodil Day? Civilization diseases and epidemics. The latest global threat is the COVID-19 pandemic, also known as the coronavirus pandemic. It was first identified in Wuhan, China, in December 2019. While most people who recover from COVID-19 experience mild symptoms, it can also lead to severe illness and even death. The virus primarily spreads when an infected person is in close contact with another person. Symptoms of COVID-19 are variable: fever, cough, fatigue, breathing difficulties, loss of smell and taste. Preventive measures include physical or social distancing, hand washing, covering your mouth and nose when you cough or sneeze. It's a good idea to not touch your face with dirty hands, let fresh air into indoor areas, and wear a mask when you're out in public. Internal organs of the human body. In the human body, we have several internal organs, including heart, lungs, stomach, kidneys, small intestine and large intestine, colon, gallbladder, pancreas, spleen, bladder, parts of the human body: head, hair, eyebrows, eyes, nose, cheeks, ears, mouth, lips, teeth, tongue, chin, neck, shoulders, arms, elbows, wrists, Hands. Chest. Breast. Abdomen. Navel, belly button. Hips. Thighs. Knees. Legs. Ankle. Feet. Toes. Fingers. Thumb. Index finger. Middle finger. Ring finger. Little finger. Pinky. Question time. Name some symptoms of COVID-19. What preventive measures should we follow to protect ourselves from the coronavirus? Name some internal organs of the body. Can you name any parts of the human body? Let's start from the head. What phrases or questions do we usually hear at the doctor's? If you enjoyed the video, don't forget to give it a thumbs up and share it with your friends. Go to our website, petraevoneEnglish.com, where you will find plenty of enjoyable exercises covering various vocabulary and grammar topics. Take care and see you in the next video.